Hi, folks. My name is Dr. Amy Pearlman. I'm a board certified urologist with expertise in sexual, hormonal, and genitourinary health. And I'm in my consultation room right now, and I want to show you what the typical conversation looks like when I'm talking to my patient about their girth goals for penile girth enhancement. So come over here. This is what I'll typically do is I'll have my patients come over to the corner of my office, and they'll look through this nice little demo area here. And what I simply say is, why don't you point to the object that more closely resembles your flaccid girth? So they'll walk over here. Usually people aren't quite sure what their girth is. A lot of my patients have never measured their penis before, so they're not certain, but they'll kind of look. Sometimes they'll kind of like hold their hand out to see what it typically looks like when their hand is around their penis, and that will help them estimate. And so oftentimes I have guys that will go over to the one that's 4 inches in girth. So they'll take this one out. And I tell them, don't pay attention to the length because we're just talking about flaccid girth here. And then I'll say, okay, well, where do you think you would like to be? So why don't you pull out the object that more closely resembles your girth goals? So they'll go over here. And oftentimes, my patients are looking for typically about an inch increase in girth. Sometimes they're looking for half an inch, but most of the time it's going to be an inch increase. So you can see here, if we just hold it this way, how they look different. And then this way, you can see the difference in girth. So it definitely is a noticeable difference. The other helpful part about showing people this little demo section right here is that it increases in size by about 1/4 of an inch as you go up in this demo. So what people can see is what they can anticipate, not only between their baseline girth measurement, but where they're hoping to end up. So for that person who's a girth, 1 inch increase, they can see that 1 inch. They can also see as we do each treatment, and the average increase in girth with each treatment using 4 to 6 units is going to be 1/4 of an inch to 1/3 of an inch increase. So they can see, let's say between the first and the second treatment, what it looks like to be 4 inches versus 4.25. They can see between 4.25 and 4.5. It's really difficult to just think about a number and see what that might look like when it comes to the penis. So this demo section is really helpful to really put it into perspective what these numbers actually look like when it comes to girth or circumference of the penis. Most of the patients that come in to see me are not coming in knowing exactly what their length is, exactly what their girth is in the flaccid or the erect states. They're coming in and they're kind of approximating what their sizes are. When I talk to a lot of people that haven't seen patients interested in girth enhancement, they have this perception in their mind of what this guy looks like who's coming in to have this conversation, where he's coming in, he knows exactly his measurements, he knows exactly what it's going to take to be happy and get to his girth goals. And folks, that's really not what I'm seeing. It's normal dudes coming into the office. They have normal sized penises. They're looking for some enhancement. They're curious about my take on what additional girth would look like, how much I might recommend they get. And it's really this beautiful conversation between them, between me, between their goals, between what they think would make their partner happy. So it's a really interesting conversation. And I think nothing like what most people think these girth conversations actually look like.